Everyone, and welcome. Um, we were discussing in the last class, aphorism 90 have been completed. Before that, we have discussed chronic diseases from Roberts. Okay, that has been completed. So today, from aphorism number 91, we will move on. I have told you that 91 and 92 is the case taking. What are these aphorisms all about? Is a general instruction for case taking. Okay, and aphorism 9, it includes some special instruction. Some special instruction have been given to the particular diseases like mental diseases. Some special instructions are there for intermittent diseases. Some special instructions are there, but altogether these consist of a general direction for case taking. And we have told that case taking is the most important part for our treatment. Whole treatment, out of whole treatment, 50% is consisting the case taking. If you know how to take the case, it will be easier for you for prescription, for prescribing. You don't know your materia medica, you don't know the indications of repertory, but if you have taken the proper case, then you can take the help of repertory, you can take the help of other teachers, seniors, or your friends. But if you have not completed your case, then no one is going to help you. So in that sense, this case taking is important. 91 and 92 consist some special instructions for the cases which are coming from other physicians. 91 and 92. Okay. It consists some special instructions for the cases which are coming from other physicians. So we will start from 91. The symptoms and the feeling of patient. I hope you have your book with you. I have told you to have your book Organon of Medicine with you. All the three philosophies which we generally refer, and Allen's keynote. At least Allen's keynote should be with you. So 91. The symptoms and feeling of patient during a previous course of medicine do not furnish the pure picture of disease. Underline this. Previous course of medicine do not furnish the pure picture of disease. But on the other hand, those symptoms and ailments which he suffered before the use of the medicine, number one condition, two conditions are there. Those symptoms, which symptoms we are going to take, which have been there before the use of. You will find often during your clinical practice that patient coming after taking antibiotics, okay, and complaining of diarrhea, that doctor, I'm suffering from diarrhea for last few days and I have taken antibiotics for 5 days. Then this is quite natural that antibiotics are producing diarrhea. Why antibiotics are producing diarrhea? Because along with the bad bacteria, it is killing the good commensal flora of the intestine. So it is producing diarrhea, and that is quite obvious, and you are not going to prescribe for this diarrhea, okay, because this is the symptoms of that medicine. So what you are going to take, if any discomfort was there before the taking of the medicine, you are going to take that. Or underline or what, after they had been discontinued for several days. After antibiotic have been discontinued for 4 to 5 days, then you will see that diarrhea the patient was complaining have already gone. Okay, so you're not going to prescribe for that symptom. Or encircle this or, after they had been discontinued for several days. Okay, so what symptoms you are going to take? Before the medicine what was there, or after discontinuing this for several days. And that is going to give the true fundamental idea of original form of disease. Underline this. And this especially the physician must take note of. Okay, this is here the first sentence of this aphorism ends. We have told the aphorisms in the Organon of Medicines are complex sentences. Okay, so here the first sentence ends. When the disease is of chronic character, now the conditions are coming. When the disease are of chronic character, and patient has been taking medicine up to the time he is seeing the physician, may with advantage he is seen, okay, comma, when disease is of a chronic character, comma, two conditions may be there. The disease patient is consulting to you, the disease may be of chronic character, disease may be of acute character. So this is the first condition where the disease is of chronic condition. So what is your duty? The physician may with advantage leave him some days quite without medicine. Okay, he will ask, come to me after 15 or 17 days of discontinuing this medicine. Or encircle this or. Without medicine, this is a aphorism which is telling about placebo. Or in the meantime, administer something of an unmedicinal nature. Underline this. Of an unmedicinal nature. This is the aphorism which is telling about placebo. Okay, unmedicinal nature. And defer to a subsequent period the more precise scrutiny of the morbid symptoms in order to able to grasp in their purity the permanent uncontaminated symptoms of the old affection to form a faithful picture of disease. Underline this, faithful picture of disease. You are not going to accommodate that diarrhea which the patient was suffering after taking antibiotic in your totality of symptom. Okay, if you are getting that diarrhea in your totality of symptom, what does this mean? This is not a faithful picture of disease. So what you have to take, two actions you have to take. If the disease is of chronic nature, okay, it is not slowly progressing, it is slowly progressing and not disturbing your patient too much. So you can, if the patient is understandable, you will say that come to me after 10 days or 14 days. But if the patient is not understandable, he will go to some other physician and leave you. Then you have to give some placebo, unmedicinal nature. Underline these two conditions. 92. If the disease is of acute character, troublesome character. Okay, this 92 has its counterpart at many instances. I will show you the aphorisms later on where this conjoint malady are there. But if it be a disease of rapid course, okay, first one was of chronic character, physician after seeing some other physician, the patient was coming to you. Again the patient is coming to you after seeing to some other physician. But this disease is of rapid character. And if it is serious character, admits no delay, physician must content himself with observing the morbid condition, alter though it may be by medicine. Underline this. The whole sentence. Must content himself observing the morbid condition, altered though it may be by medicine. If he cannot ascertain what symptoms were present before the employment of medicine, in order that he may at least form just an apprehension of the complete picture of the disease in its actual condition. That is to say, the conjoint malady. Underline this. That is to say, the conjoint malady. Underline this. Formed by the medicinal disease and original disease. Underline this. How the conjoint malady has been formed? By the medicinal disease and with the original disease. Okay, underline this. Which from the use of inappropriate drugs is generally more serious and dangerous than was the original disease. This conjoint malady is now more serious. Why it is more serious? Because the abuse of the drugs. By the thus tracing out the complete picture of disease, he will enable to combat it with a suitable homeopathic medicine, so that the patient shall not fall a sacrifice to the injurious drug he has swallowed. Combat it. Underline this. Conjoint malady and combat with your medicine, whatever picture you are forming of your conjoint malady. Okay, this aphorism we will refer to again and again to 3 or 4 times. Okay, later on this has its counterpart in later chapters of Organon, means later sections of Organon. We will refer it back again and again. Now number 93, we have told that in case taking you should remember some aphorisms which are often the direct question in your MCQs examination. Okay, if you see the current MCQ, what have been asked in current AIPGT, you will be astonished to see those are very easy. Okay, and if you have gone through those aphorisms, you will easily be recognized. Those questions, you will be easily recognizing those questions. So there are some aphorisms which are direct question. I have told you that 90, aphorism number 90 is often a direct question, for physician's observation. How to remember that? That is observation and O, 90. 0 is equal to O. So aphorism number 90 is for physician's observation. Likewise, aphorism 93 is for obvious cause. Okay, don't confuse O with observation, not O for obvious cause. Okay, 93 is for obvious cause, and it is often a direct question in your examination, in MCQ examination. This case taking section contains so many direct questions like this. Okay, like hypochondriac or those patients who are indolent. These are all direct question in your examination. We will discuss this. So aphorism number 93 is for obvious cause. What is the obvious cause? Actually, the obvious cause is the patient, the cause which patient is not willing to share. Okay, so for that you have to use some techniques. One technique we have discussed before: let the patient describe his suffering. Let the patient tell what he have to tell without interrupting. Okay, and one technique is that let the patient, you ask a question after getting familiar yourself with the patient. Okay, means why he's going to share the personal history to you. Okay, why he is going to share his personal detail to you. He has come to you for a headache. He don't know that his headache is associated with some personal cause. So he is not going to share that personal cause with you. So try to make the environment freely comfortable for the patient. If you are unable to get the required information by the patient, it is your failure, not the patient's failure. Okay, so you have to make an environment like that. Okay, one technique is that if the patient is sitting in front of you, try to have less and less obstruction before you and your patient. Okay, try to select the patient means alignment like that. Let me show you. One of the technique I use in my clinic is I have told you these techniques I have learned from the book Homeopathic Conversation and other psychological books. Okay, so these are the techniques you can use during your case taking. Suppose this is your table. Okay, suppose this is your table. You are sitting here, your patient is sitting here. Okay, try to minimize the obstacles. If your repertoire is in between, if your nameplate is here, if these things are here, this will not let your patient free to yourself. That is having a psychological impact on your patient. Okay, that is going to have a psychological impact on your patient, and he is not going to free. Try to keep this area clean. Number one. Number two, if you have a seat here, that will be better. That will be far better. That you can have a direct special contact with your patient. If your patient can sit here, this will be far better. If your patient can sit here, that will be far better. That will make your patient comfortable without any gap in between. Okay, this is one technique. Number two, try to sit in the mirror image of your patient. Okay, you will see those who are a very good case taker, they won't actually have to do these things. These will be automatically done. If the patient is sitting like this, the physician will also be sitting like this. This is mirror imaging with the patient. This is one of the technique to make the environment very much comfortable to your patient for draining out. If the patient is sitting like this, try to sit like this. Okay. If the patient is sitting cross-legged, try to sit in the mirror image with your patient and see the result. From now onward, use these techniques during your case taking. Okay, and you will be astonished to notice that how easy the case taking is for you. Okay, case taking is an art, and you have to make your patient comfortable. You have to make your patient comfortable, and many more things you will learn as you progress in your clinical life. Okay, many more things you will progress, many more things you will learn. These are some techniques you have to utilize in your I am telling you, you can utilize in your case taking. Okay, so this getting this obvious cause is very difficult, but for those who are master of their psychological nature, human nature, they will get these. Okay, so 93, if the disease has been brought on a short time, or in the case of chronic affection, a considerable time previously by some obvious cause, underline this, then the patient or his friend, when questioned privately, one more technique is this, lowered the tone of your voice, lean forward to your patient like this, as if you are telling some important thing. Okay, I generally ask these things at the end. Okay, at the end of all, present complaint, physical general, past history, family history, I ask these things, mental things or obvious cause. I ask is lately, after 15 or 20 minutes of conversation, I ask, मन मिजाज कैसा है, মন মেজাজ কেমন? Then patient will say, ঠিক আছে, আচ্ছা, ঠিক আছে, একা থাকতে ভালোবাসেন না সবার সঙ্গে থাকতে ভালোবাসেন? একা থাকতে ভালোবাসেন. That is the way you will lead your patient to these type of questioning. Okay, এমন কোনো ঘটনা হয়েছে জানিয়ে মনে দুঃখ, রাগ বা অপমানের ফিলিং আছে? And wait there. Okay, you ask this question and wait there. You will observe the patient has fixed his, if this obvious cause is there, a sort of psychological obvious cause is there, the patient will fix his gaze at some point in your clinic, at some, this is called probing. In psychology, this is called probing. This is the moment you should not disturb your patient. Wait for 5 minutes, wait for 10 minutes without any disturbance. Let the patient probe, and if the obvious cause is there, the patient will tell you. But if you have disturbed in between, patient will never tell you. This is called probing, and this is the moment you have to give your patient, time to get that obvious cause. So this is technique number 3 I use during case taking, to take this obvious cause privately. We'll mention it either spontaneously or when carefully interrogated. Okay, so what are those causes that have been discussed in the footnote? Any cause of disgraceful character. To these belong poisoning, attempted suicide, onanism, indulgence in ordinary or unnatural debauchery, excess in wine, cordials, punch, and other ardent beverage or coffee, overindulgence in eating generally in some particular food. These are the things. Complex emotions, jealousy, unfortunate love, okay, revengeful attitude, balk, insult or revenge. These are something the patient is not going to accept very easily. Okay, one of the patient, I remember of one of my teacher's case, the lysine was prescribed, and he was a complete failure case. Means many stalwarts of homeopathy have seen him for a ulcer on the glans penis. Okay, and all sort of medication have been prescribed. But by this technique, by using case taking, the patient have accepted that once he have debauches with a bitch, means that is perverted sex with a dog. Okay, that patient have accepted that sex I have, once I have a sex with a dog. That is quite obvious living example of that obvious cause. And I remember how how that patient was able to tell that thing. Okay, by proper case taking, and lysine was prescribed for them, for that patient, and the patient was cured. So this is the example from case taking, how the case taking is helping. Otherwise this patient was not going to be helped by any other method, any other homeopathic medicine. Okay, so it was a complete failure. Whenever a failure case coming to you, and if it is by some stalwarts, try to search the obvious cause, because the big doctors, the stalwarts, are very busy sometime, and they don't care too much about details, too much about minute detail. Sometimes they don't care too much about minute details. So try to sort out some cause. If it is there, try to prescribe on that. Okay, so this is the obvious cause, and that was the case, very interesting case I have shared with you. Aphorism number 94. What point is particularly to look for in chronic disease? This 94 and 95, actually the main thing is coming in aphorism number 95. Before that, 94 is actually, we have discussed accessory circumstances. Accessory circumstances we have discussed, and we have given a reference to aphorism number 208, aphorism number 94, aphorism number 252. Okay, how this accessory circumstances is going to maintain the disease, how this accessory circumstances has occasioned the disease, same thing is there. Aphorism number 94. While inquiring into the state of chronic disease, the particular circumstances of the patient with regard to his ordinary occupation, his usual mode of living, diet, his domestic and so forth, must be well considered, scrutinized, to ascertain that what there is in them that may tend to produce or maintain, underline this, produce or maintain, in order their recovery may be promoted, in order that their recovery may be, their removal, the recovery may be promoted. After, in footnote, pregnancy and all the female symptoms have been particularly mentioned. This is important, and I remember this has been a question somewhere in AIPGT, that where Hahnemann have discussed that this should be taken in account. Okay, and here also in aphorism number 90 footnote 6th edition, menstrual and other discharges, very important in regard to MCQs. Aphorism number 90 and aphorism number 94 footnote, 96th edition and 94 footnote regarding female symptoms should be taken care of. Okay, we have discussed these accessory circumstances before. Recordings are there, you can refer there. So aphorism number 95. Aphorism number 95, the famous lesser accessory symptoms. Lesser accessory symptoms. It is actually, someone please read this aphorism. Read this aphorism. Rashmi, can you read for us?
Yes, sir.
Okay.
In chronic diseases, the investigation of the signs of disease above mentioned and of all others must be pursued as carefully and circumstantially as possible, and the most minute particularities must be attended to, partly because these are the most characteristic and least resemble those of acute diseases, and if they cannot be partly because the patients become so used to their that they pay little or
Okay,
no heed to
stop
the
here.
less.
Stop here. Underline first chronic diseases, where this lesser accessory symptoms are going to help you in chronic disease. Underline that. Next, most minute peculiarities. Underline that. Next, they are the most characteristics and least resemble those of acute diseases. Least resemble those of acute diseases. Minute peculiarities. You won't get these minute peculiarities in those acute diseases. Partly because if a cure is to be affected, cannot be too accurately noted. Partly because if the cure is to be affected, underline comma, give a comma is missing here. Next, they cannot be too accurately noted. Why? Why they cannot be too accurately noted? Partly because patient becomes so used to their long suffering that they pay little attention or no heed. Little attention or no heed to lesser accessory symptoms. Underline this. Underline this. Lesser accessory, no heed to lesser accessory symptoms, which are often very pregnant with meaning, characteristics. Very pregnant with meaning, characteristics. Often very useful in determining the choice of remedy. Underline this. Often very useful in determining the choice of remedy. Okay. Underline this. This very useful in determining the choice of remedy. We have discussed before somewhere also that those characteristic symptom 153 in those intermittent section, intermittent fever, Hahnemann have told the symptoms which are coming after paroxysm is over are characteristics. In mental diseases, the symptoms of mental sphere are the important symptom. Here also these lesser accessory symptoms with the patient is paying less attention out of means for prolonged suffering they have forgotten. It is actually a flat symptom in the time it is present. Let me show you with this. In acute disease, what actually happens, the symptom is so characteristic, the patient will tell you so much painful that patient will tell you time is short but intensity is very much, that patient will probably, okay, so much intensity is there, but here the totality is somewhere lost in time. Okay, it is constantly present throughout this life of the patient, constantly present. Okay, but with less intensity. That is why the patient is not paying attention to it. Got it? This was a vertical totality, vertical symptom, and lesser symptoms are flat totality, flat symptom. Patient is, why patient is not paying much attention? Because it is not of that intensity. One of my patient, actually this is one of the case I have read somewhere, but I have experienced this in my clinic also in OPD during my PGT days. One of the patient was telling that whenever Dr. Babu যখনই আমি পায়খানা যাই তখনই আমার চোখ দিয়ে ঝড় ঝড় জল পড়ে, আমি জানি না কেন জল পড়ছে. Okay, whenever I go to toilet there is lacrimation from my eyes. I don't know why this is happening, and this is one of the symptom of thuja. This is one of the symptom of thuja. That patient was not not paying attention to it, but after proper case taking, patient divulged this symptom, and over this symptom often very useful in determining the choice of remedy. Because why? Because it is very characteristics, very characteristics. Okay, 150. What is there in 153? 153. Go to 153. 1, 2, 3, 4, 5, 6th line. See, chiefly and most solely to be kept in view. Very characteristics. That is not that we are prescribing on a single symptom. Okay, that is not that. But this peculiar, very much peculiar to certain medicine. Okay, see this movement from slightest motion, movement from motion, and movement from slightest motion is very much characteristics for brainia patient. So this one characteristic symptom only, midnight aggravation, midday aggravation, is just narrowing down our choice of medicine. And often it is arsenic. Out of 10 patients who are having midnight aggravation, 6 to 7 will be of arsenic. So you just have to confirm with the other symptom to prescribe your medicine. So this should be, these are the symptoms which you cannot keep outside the totality of symptom. You must have to consider it, chiefly determining the choice of remedy. Okay, suppose there are 5 symptoms and one is very characteristics. One is very characteristics. You can leave 2 or 3 symptoms of that, but you cannot leave this characteristic symptom. Okay, you have to include that characteristic symptom in your totality. Okay, so that the choice of remedy will be felicitated. That is why this lesser accessory symptoms is important, because it is very characteristics, uncommon, peculiar. Okay, so next, read next.
And regard them almost as a necessary part of their condition, almost as health, the real feeling of which they have well nigh forgotten in their sometimes 15 or 20 years of suffering, and they can scarcely
I'm told
bring
that flat
themselves.
suffering. The symptom have become flat. It has lost its spike. It has lost its intensity. The symptom have been flat now. So they are not paying much attention to them, or they have forgotten this symptom. That this is not a normal condition. Why I am having tears from my eyes while eating? This, for them, this is normal. Why I am constant tear in my eyes while yawning? This is their normal symptom. But for us, it is having its importance. Next.
And they can scarcely bring themselves to believe that these accessory symptoms, these greater or less state, can have any connection with their principal malady.
Okay, they are not giving much attention. They are not aware that this can have any connection with the principal remedy. Okay, for the beginners, it is very difficult to take the case in from homeopathic point of view, because the patient will start laughing at you. Okay, doctor, why you are asking such foolish questions? But you have to practice this question, these techniques, so that for the beginners it is actually difficult to take the case, to actually take these lesser accessory symptoms or asking some peculiar question to your patient. Okay, but with the time you will be accustomed to ask, how to ask. You will develop with the time. No one is going to teach actually how to take the case. Some of you were telling that, sir, please teach me how to take the case. No one is going to teach you how to take the case. Only I can tell you the techniques. Further, you have to evolve yourself as a clinical organism. Okay, you have to evolve yourself. No one is going to, you have to evolve in your clinical setup yourself, that how to bring the patient to that verge, so that he is unhesitantly telling you everything. I have told you that how we were been asked by one of our teachers to just to listen the patient. Okay, and one thing, if I have to tell you, out of all case taking, try to polish your hearing power, try to polish your listening power. Okay, this will going to help you in case taking. So aphorism number 96 is for hypochondriacs, and aphorism number 97 is for indolent patient. Okay, how to remember this? Which is 96, which is 97? A hypochondriac will exaggerate his symptoms and he will come first. He will come first. So it is hypochondriac is coming first. 96. After that, indolent. Indolent is lazy, sitting there. So after that, indolent patient is coming. Read 96.
Besides this, patients themselves differ so much in their dispositions that some, especially the so-called hypochondriacs and the other persons of great sensitiveness and impatient of suffering, portray their symptoms in too vivid colors and in order to induce the physician to give them relief, describe their ailments in exaggerated expressions.
Okay. So some of you were asking before that how to take this case in how to take case of hypochondriacs. Okay. So exaggerated suffering. First of all, keep in mind this hypochondriacy is a symptom in itself. Okay. Hypochondriacy and oversensitiveness is a symptom in itself. Hypochondriacs are not the feigners of disease. Remember that. They are not feigning. They are just exaggerating their symptoms. They are not नाटक नहीं कर रहे हैं वो लोग, है ना? दर्द है पेट में. There is a pain in abdomen, but that is exaggerating their symptoms. So take dard instead of take that pain, instead of putting plus sign to this, just write down pain. Okay, not exaggerate. They are exaggerating, you should not exaggerate. They are not feigners of disease. Okay, and for honors question, often you have been asked in your Viva examination how you will how you will differentiate between a feigner of disease and hypochondriacs. Okay, with the hypochondriacs, if you have given placebo, will not act on it. Okay, because the symptoms was there, but with the feigner of disease will act that हाँ दवा खा के हमको आराम मिल गया. But you know that I have not given a medicine. That was he was feigning the disease. So read this footnote.
A pure fabrication of symptoms and sufferings will never be met within hypochondriacs. Even
underline this.
Impatient
That is what I have told you. Next.
Even in them, a comparison of all these at variation gives them or something quite plainly. Deduct something from their exaggeration. At all events, ascribe this strong character of their expressions to their excessive sensibility. In which case, this very exaggeration of their expressions when talking of their ailments become of itself an important symptom in the list of features of which the portrait of the disease is composed. The case is different with insane persons and rascally feigners of disease.
Okay, unmedicinal nature, underline that. This is an instance where Hahnemann is talking about placebo. Okay, these 2 points I have discussed. What have been discussed in footnote, we have already discussed. Now go to 97.
Other individuals of an opposite character, however, partly from indolence, partly from false modesty, partly from a kind of mildness of disposition or weakness of mind, refrain from mentioning a number of their symptoms, describe them in vague terms, or allege some of them to be of no consequence.
To be of no importance. Consequence here means of importance. In English language, there are many words which are having two different, altogether different meaning. Okay, so consequence here is you can use as importance. Okay, of no importance, partly from indolence, partly from false modesty, partly from a kind of mildness of disposition or weakness of mind. Okay, there are individuals who are not telling their symptoms. Why they are not telling their symptoms? Because they are too lazy to tell, because they are having shyness that डॉक्टर क्या सोचेंगे हमको ये होता है. ओके, एंड माइल्ड डिस्पोजिशन, नो नथिंग इज देयर, ठीक है ये तो चलता रहता है, जिंदगी है तो चलेगा. सो दिस इज वन ऑफ द শরীর থাকলে কষ্ট হবেই ডাক্তার বাবু, কি বলা যাবে, আপনি এটাই দেখুন ছেড়ে দিন. তো দিস ইজ Opposite, exactly opposite of that, hypochondriac. And this is also one of the symptoms you can utilize for your medicine. 98. Aphorism number 98.
Now, as certainly as we should listen particularly to the patient's description of his sufferings and sensations, and attach credence especially to his own expressions, wherewith he endeavors to make us understand his ailments. Because in the mouth of
Underline
his
this.
friends and attendants,
Underline this. Credence, especially, we have discussed this point before, that these to whom we are going to give much importance, to the patient. Next.
because in the mouths of his friends and attendants they are usually altered and erroneously stated. So certainly, on the other hand, in all diseases, but especially in the chronic ones, the investigation of the true, complete picture and its peculiarities demands special circumspection, tact, tact, knowledge of human nature, caution in conducting the inquiry, and patience in an eminent degree.
Underline all these characteristics. These are the further characteristics of physician required during case taking. Special circumspection, tact, knowledge of human nature, caution in conducting the inquiry. You should not ask direct questions which are suggesting the answer, and patience in eminent degree. Patience is patience for listening to your patient. Okay. Number 99. Why the acute disease are easier? Case taking of acute disease are easier because here 99.
On the On the whole, the investigation of acute diseases, or of such as have existed but a short time, is much the easiest for the physician, because all the phenomena and deviations from the health that has been but recently lost are still fresh in the memory of the patient and his friends,
Underline this.
still continued.
Underline this. Easiest for underline investigation of acute disease. Underline easiest for physician. Underline all the phenomena and deviations. Underline fresh in the memory of patient and his friend. Okay. Underline novel and striking. Novel and striking. Here the first sentence end. Next, the physician certainly requires to know everything. In such case also, you have to know everything, but you have to less inquire into. Underline this. Much less inquire into. Promptly detailed. These informations are promptly detailed to him. Okay. And they are most part spontaneously detailed to him. Less inquire into. That is why easiest. For example, number 99. You can give the heading acute disease. Question of acute disease is easiest. Why? Because the phenomena is recent, fresh in the memory, plus they are striking, having this peak, not that flat, suffering for time, suffering for years. That is flat, easiest. That कल तो ऐसा नहीं था, आज ऐसा हो रहा है. This is the new deviation I am having. Okay. So aphorism number 100, 101, 102 and 103 is regarding case checking of epidemic, sporadic or epidemic disease. Okay. 103 is for case checking for miasmatic disease. How to find for a remedy for a miasmatic disease. We will discuss in the next class. Okay. 104 is for recording case records. What is the importance of case record? Okay. Any question you are having, you can ask so that we can answer those in 5-4 minutes. Any doubt, any question you are having, you can ask.
सर
Yes.
सर एक क्लास का ना रिकॉर्डिंग नहीं है, तो वो अगर मिल जाता.
कौन से क्लास का रिकॉर्डिंग नहीं है?
लास्ट के पहला वाला.
अच्छा,
Sir,
तो हम लोग तो
21,000.
21.
Date 21.
ओके, वो क्लास तो शायद कोई आया नहीं था तो हम लिए नहीं शायद. ठीक है. The class has not been conducted, I think. Just go through the sequence. If the sequence matches, that means no class have been conducted on that day. If the sequence matches, that means no class have been conducted on that day. Okay.
ओके सर.
Okay. Any question? You're most welcome. And upgrade your Teachment app. Okay, if there is an option for upgradation, please upgrade. You cannot. You also may lose the recording because of that upgradation. Okay, if there is a option for upgrading, upgrade the Teachment app. Thank you.
Thank you, sir.
Thank you, sir.